I got my cataract surgery back on September 30th of 2021. So today is March the 7th of 2022. So it's been about 5 months since the date of the surgery. And so I wanted to give another update. As I've had, following the surgery, I've had two follow-up updates, roughly a 1 month and then now a 3 month, roughly. And so it's been a total of 5 months, as I say, since the surgery. And of course I had if you've watched any of my prior videos, you know that I had the Panoptix lenses, multifocal lenses implanted in both eyes on the same day, at the same time, basically, same surgery day. And so I wanted to kind of talk about the results so far. So far, the results have been an unbridled success. They've been excellent. I have overall 20/20 vision. And that's including distance, intermediate, and near, with the only exception being the near. Actually, they told me this last time that I went into it for the second checkup. She told me that it was actually the near was 20/12 because she had some very small text. And of course she had a light shining on it, pretty bright light, but she had some very, very small, just really tiny text that normally, in the old days I would have needed some sort of a reading, like a magnifying glass in order to see it. I was actually able to read it, and so she told me that that was considered 20/12 as far as the near went, the near vision. But overall, I'm 20/20. Now, from a visual artifact standpoint, I still see halos, I guess you would call, most people are calling them halos, around certain lights at night, and it kind of depends on what color the light is, and then I think also the angle of the light, and and maybe if the light is more pinpointed or not, but that it really seems to be more about the angle, I'd say, than anything else. Because let's say that it's at night. I do a lot of night driving, by the way, and I'm seeing just fine. And fortunately for me, the halos, that type of visual artifact doesn't bother me. But it's interesting because let's say that I'm in a parking lot and it's night, and maybe there's some like a brake light or something on some vehicle that's parked, then the light's on, maybe a clearance light or something, and at certain distances I can clearly make out the halo, and of course that's due to the structure of the Panoptix multifocal lenses themselves, because they have concentric rings. If you actually look them up and look at the construction of them, because you can find pictures of them on the internet. So it has to do with the structure of the lenses itself, is why the halos are showing up. But let's say I can see a halo, I can clearly see a halo or a set of halos around a light, then if I begin to walk, like if it's in a parking lot and it's at night and I walk towards the light, at some point those halos are going to disappear and I'm just going to see the light like I normally would. But so it has to be at a fair distance, in order to be able to see the halos, and you know, and really to make them out very clearly, because then if they're too far away, they no longer resemble halos. Now, like if I look at like up at the night sky, I can easily see stars and what have you, as long as the sky's dark. And I'm not seeing halos around stars, and I really am not seeing halos per se, like on a bright moon. If you know, you got a dark night with a clear skies, bright moon, I don't really see halos around the moon either. So, but that's really the main artifact that I'm seeing. Now, I kind of, if I focus on something close up like my finger, so I'm sort of looking a little bit cross-eyed, focusing on my finger, because my finger's, it's just maybe 9 inches or something in front of my nose. I can, around the edges, I can sort of see a bit of an arc, and that sort of has to do, I think, with the lenses themselves. But that's something that often happens to anybody that gets cataract surgery. It doesn't happen to everyone, but that's one of the things that can happen, and I've kind of just sort of grown used to it. I don't see it all the time. The only time I'll see it is if I'm really kind of looking cross-eyed to a large extent. Then I can kind of see it, sort of out on the periphery of my vision. But if I'm just looking off in the distance, then I'm not seeing any kind of arcs along the side. And you can get, it's sort of a binocular type of effect. And, prior to the surgery, if I really looked like that, looked cross-eyed, basically, staring at something really close up in front of my nose, I could kind of, and this was prior to the surgery, I could still see a sort of a binocular effect where, sort of the periphery of the vision is basically, it's kind of reduced because your eyes are sort of focusing together on a single point. So since the surgery, that's a little bit more pronounced than it was before, but it's like I say, that happens to a lot of people, and some people it bothers. With me, I've really gotten used to it. Now, what they told me, they check up 1 month after, and then like 3 months after that, and she told me that by now, some people will start forming the, so-called secondary cataract, where cells that might be left over from the lens, the natural lens, can actually start forming a film on the back of, on the surface of the lens capsule. The anterior surface of the lens capsule that would be behind the natural lens. With about roughly 1/3 of cataract patients, they can begin to form a film, kind of a brown film, and it's, kind of a secondary cataract is, but now I know in my case, she said everything still looks perfectly clear, so that hasn't happened. Now, obviously it could happen at any point in the future. So I will go back. I've got another appointment. The next appointment is, I think it's, I'd have to look, but it's kind of, late in the summer in 2022. So it's a few months from now I'll be going back, and then they can take another look. But as of right now, I'm seeing, I do a lot of nighttime driving, as well as daytime driving, and I'm seeing extremely well. And I've gotten really used to being able to just see things close up, intermediate, and at distance without any kind of reading glasses, because before I was always just, constantly grabbing those reading glasses. So now, of course, you go back and watch my prior videos, I was a little, I did a lot of research. I watched, I don't know how many videos on YouTube prior to the surgery, and, kind of going through all the pros and cons of the different types of lenses, and reading things on the internet, where people not only had good outcomes, but bad ones as well, or they, or they weren't as happy as they should have been. And so, but I think a lot of that can be alleviated if you do a bunch of research. And of course, I really researched it, and I ended up kind of being happy with, more or less, I guess you could say, happy with my choice prior to the surgery. I was kind of had researched it enough so that I was prepared, mentally prepared for whatever outcome. So in this case, the outcome that I got was about as good as it possibly could be. Because, as I say, I'm 20/20 overall. I've got all of the benefits of the multifocal lenses, the Panoptix multifocal lenses. And, even though I do have some visual artifacts at night, which I knew that I would have going into it, I knew that would happen, and but I was able to live with it. And one of the reasons that I knew that I'd be able to live with it is because, as I've said in the prior videos, for my entire life, as long as I can remember, I've had lots of floaters kind of floating around in my vision, and they bother some people, but the floaters have really never bothered me at all. I've just, they're there, and I'm just used to them. So I'm just able to ignore them, and they've never bothered me. So I figured that any visual artifacts like halos at night around tail lights or other types of street lights or whatever wouldn't bother me either, and that turned out to be the case. It just it's not a bother, but it really is something to be able to see and read close up and not have to have any kind of glasses, as well as being able to see in the distance and not have to have any kind of glasses or contact lenses. So far so good. I'm very pleased with the choices that I made. Now, of course, it ended up being $4,000 an eye is what they charged, and that was everything. I went to Vold Vision. Dr. Stephen Vold is the one that did the surgery, Fayetteville, Arkansas, and so it was $4,000 an eye essentially, and but that includes everything. That includes all of the post-op visits, or any kind of thing that they need to do regarding to kind of take care of the cataract surgery. So should I need them to do something about the so-called secondary cataracts, then that would be included if they needed to do anything with that. But so far so good. Everything is looking as good as it possibly can, and so I would do it over, with this outcome, even with the visual artifacts. I would go for the Panoptix lenses again, but at the same time, I would go for the full package. As far as I wouldn't try to skimp on anything as far as how they're doing. How you would have them do the surgery. Because he went through the whole complement of the technology that he uses in order to do this, and I think that really is important as far as the outcome goes. At least, I believe it is. And in my case, it's possible that it just turned out good, but I may be, statistically that most of them are going to turn out good. And you're going to always have some that don't, and that's always also a risk that you could be one of the outliers. So, but I would go for the multifocal lenses again easily. But you want to do, before you jump into anything like this, you want to research it and research it and research it. Now that, with some people, that can be a downside because then you've researched it too much, and if the research makes you, the research that I researched things, so that it kind of got rid of any anxiety I might have. But if you're researching and it increases your anxiety, then then it's time to kind of pay attention and But, so it is possible you could probably research something too much, but at the same time, all of the research and watching all of these videos and what have you, including videos from the Vold Vision Clinic itself, they've got a fair number of videos out there as well. I was able to just kind of jump into it with both feet and didn't have a problem going ahead with having both eyes done on the same day, because not every doctor will do that, and that's Dr. Vold's preferred way of doing it. Is like in my case, they just wanted to do both eyes on the same day, get it taken care of, and within 48 hours, I was basically seeing 20/20. I basically had the vision 48 hours after the surgery. I had the vision then 48 hours after the surgery that I have right now, which is quite amazing. So I will be posting the next follow-up video after I have the next follow-up appointment. So until then.